So population aging is partly due to the really spectacular linear increases in life expectancy we heard about this morning from Dr. Hodis and others. Increases at 2.5 years per decade over the last 170 years, and no sign of slowing down now. This is extraordinary, but it also raises some important questions. How long are we going to keep having life expectancy rising at 2.5 years per decade? How long can that continue? Why is the U.S. 4 years behind the leading countries in terms of life expectancy? We've had an interesting National Academy report on that a few years ago. Smoking is a big part of the answer. Are the years we're gaining years of health and activity, or are they years of disability? Well, the trends in the 20th century were very favorable, particularly the last couple of decades of the 20th century. But since 2000, the trend has flattened out, and it's not clear what's going to be happening in the future, and it's, of course, extremely important for all of us and for society in general. Okay, so that's the mortality side, but somewhat surprisingly, perhaps, the low and declining fertility is an even more important cause of population aging than longer life. And at this point, almost half of the world's population is living in countries where fertility is below the replacement level of 2.1 births per woman. If such low fertility continues in those countries, it means that in the long run, population will decline. Well, in a slowly growing or declining population, new generations are relatively small compared to older generations, and we have population aging. The population pyramid, in the extreme case of declining population, becomes inverted. So why is this an economic concern? Well, older people in virtually all societies consume a great deal more than they earn. And that gap between consumption and earning has been growing wider in the US and in many other rich industrial countries. Why is it growing wider? Well, over the last century, the age at retirement has fallen by 10 years. We're retiring now about 10 years earlier than we did 100 years ago, despite a recent uptick starting in the mid-90s. So that's part of the story. But it's also the case that consumption by older people has grown much more rapidly than consumption by younger adults. So the ratio of consumption by an 80-year-old to a 20-year-old in the US has doubled. It's doubled in the last 50 years. Why has it doubled? Well, it's doubled largely because of big increases in healthcare expenditures per older person. And how are these increases in consumption in excess of earnings funded? How is it made possible? Well, partly by public sector programs, Social Security, and for health care, of course, Medicare and Medicaid are extremely important. In the US, our asset accumulation, at least for the more prosperous people, the asset accumulation is extremely important, and people live partly by living in houses they own and receiving services of that asset, but also employer-provided pensions and private savings and so on. That's more so in the US than in other rich industrial countries. In other parts of the world, in some other parts of the world, East Asia, for example, the family helps to materially support older people. In the US and in other industrial countries, it's the reverse. Older people lend material support, on average, to their children and their grandchildren. Well, when population ages, it concentrates more of the population in these ages where there's a big gap between consumption and earning. And that poses economic problems. But they're problems that can be addressed by policies and changed behaviors and new institutions, as Jack was suggesting a moment ago. And let me give some examples. So, as fertility falls and there are fewer children in families and in societies, it's easier to invest more heavily in the education and the health, that is the human capital, of each child. And in fact, that's what happens as fertility falls, and that's what happens that's what we see when we compare high fertility and low fertility countries. And then these children with more human capital grow up to become more productive workers, and we're substituting quality for quantity in the labor force. Second, for somewhat similar reasons, in an aging society, population grows more slowly, the labor force grows more slowly, and it is easier to invest more heavily in capital per worker to raise productivity of labor, and it's easier to invest in social infrastructure to raise the welfare of individuals in the society. And then finally, I think that as longevity rises, we can expand each segment of the economic life cycle proportionately so that we study longer, we work longer, and we can also retire longer. It seems very natural that as we live longer and in better health, we would work longer, but there's a great heterogeneity in our society, and in fact, it turns out that, say, the lower quintile, or the lower 2 quintiles perhaps, of the earnings distribution have experienced almost no gains in life expectancy at all in recent decades, while the upper quintiles have experienced fairly rapid life expectancy gains. Well, how do we deal with that? One possibility would be for Social Security to raise the retirement age for those with higher lifetime earnings and raise it less or leave it the same for people with lower lifetime earnings. It may sound implausible, but in fact we already do something very much like that on the side of annual benefits through Social Security. So, population aging is going to bring important problems, but these are not catastrophic problems, and I believe we can address them successfully with policy and behavioral changes. Thanks.
Ron, just to add one other idea, just to get people thinking about some of the policies, another strategy might be with respect to the retirement reset for Social Security. Many people in the lower socioeconomic portions of the population, as you say, they've not increased life expectancy. In fact, we had some work that showed that less educated white women actually had lost 4 years of life expectancy in the last 2 decades. Many people in that portion of the population have been working for a very long time. They enter the workforce at 16, 17, 18. I entered the workforce after, medicine and residency and fellowship, and what was I, 30-something. So one way you could do it is index to how long they were paying into Social Security, not so much how much, and make them eligible at a different time than people who got in later.
Sure, that's another good idea.
So there's another, it's kind of orthogonal to your idea, but it's just to show that there are different ways that you could try to push this around. The problem really is if you really increase the retirement age of Social Security, many of the poor people with shorter life expectancies who've been paying in for a long time are never going to collect a penny. And that doesn't seem equitable, certainly on the surface.